Thank you for giving us an opportunity to come speak to you about the benefits and services that are provided by the Veterans Benefits Administration. I'm going to talk a little bit about the local and national initiatives that are being implemented by the Winston-Salem Regional Office, and then Megan and Shai are going to discuss more specifically the programs that are offered by VBA. So in line with the Secretary's modernization efforts, the Winston-Salem office has developed our own modernization initiatives. The first of which I wanted to talk about is the Justice-Involved Veteran Outreach. Excuse me. This program supports veterans while they're incarcerated and also during their transition back into the community. So we hope to ease the burdens of their transition by assisting with financial hardship, avoiding homelessness, and also preventing suicide. And to do so, our goal is to increase awareness of VBA benefits and decrease the time to restore benefits upon release from prison. The program right now involves working with the Butner Federal Corrections to provide a benefit resource fair to increase the awareness of veterans who are near release in the next 18 months or so. As well, we're developing a mailing for incarcerated veterans across the state of North Carolina to provide benefits information to them. Lastly, we established a direct phone line to our regional office for inmates as we learned that they are unable to access the 1-800 number to our call centers. So this enables them to reach people at our regional office who can talk to them about their claims and any information that they might need. The second part of our modernization plan involves new avenues of outreach around the state to encourage veterans to choose VA. So through developing a more comprehensive and data-driven plan, our goal is to increase the percentage of veterans who are receiving benefits and utilizing services. So in North Carolina, there are about 800,000 veterans, but of those, only about 23% actually are in receipt of benefits from VA. So we've gathered data to determine what areas around the state have low percentages of veterans in receipt of benefits, and we hope to use both traditional methods of outreach and some new avenues and outreach strategies to target those populations to increase their awareness. Some of the new initiatives we're looking to expand in the next few months is partnering with local sports teams and local employers, as well as attending community events such as resources and fairs to reach a broader veteran population that we might not normally reach, but to also reach the family members of veterans to increase their awareness as well. An additional program that the Winston-Salem office has embraced is the Storytellers X program. This program is based on the Got Your Six series, which was launched to change the negative or inaccurate perception of veterans in our communities. And what the program allows for veterans to share their stories of service and success to bridge the divide between the military and civilian people in the communities. We participated recently in the first of these events in North Carolina in Mooresville, and have actually incorporated the videos that were created there into our new employee orientation as a way to increase the connection of our new employees to the veterans that we serve. We're also exploring participation in future sponsored Storytellers X events around the state as well as hoping to launch our own program at the Veterans Experience Action Centers that we participate in. And the VACs, if you're not familiar with them, provide veterans a great opportunity to receive face-to-face assistance, to ask questions about their claims, but to also gain information and knowledge about the claims process itself. The next one of those events coming up is in Wilmington, and that will be March 22nd through 24th. As Jeff mentioned, the Character of Discharge Emergency Care Determinations. This is a program that is intended to help with suicide prevention, specifically targeting those veterans with an other than honorable discharge. The program allows former service members with those kinds of discharges to receive mental health treatment from a VHA facility for up to 90 days. The Winston-Salem office is one of 2 offices who were chosen to process the claims for these veterans to provide a special review for determination of potential continued or future eligibility to health and/or benefits. And I wanted to mention just in talking about suicide prevention and awareness, the executive order that the President signed on January 9th of this year. Data shows that veterans experience suicide rates at twice the rate during their first year following separation from service than those in the general veteran population. So this is just a quote from Secretary Shulkin regarding this that I wanted to give you an opportunity to see. But the program is going to involve coordination between the Departments of Defense, Homeland Security, and VA to provide treatment and access to mental health care for 1 year following separation to address that concern. Largely, the program will be implemented by VHA, and I'm sure Ms. Seekins will have more information as the plan is developed. They are charged with a 60-day plan for the program. And moving on to the national modernization initiatives that are more specific to the Benefits Administration, I wanted to talk about decision-ready claims, which was introduced in September of 2017. In partnership with veteran service organizations, the DRC program, the DRC program provides a claim submission option that promises much faster decisions on claims for veterans and their family members. And right now, the goal of that program is to provide a decision within 30 days. So the VSO submits the claim, and they will help the veteran to gather all of the necessary information that's needed to support the claim, to include private medical records, military service records, and also a CMP examination if that's needed. Once the claim is received, then we are able to streamline that, and nationwide we've received 577 of these claims, and of the 537 that have been completed, the average days to complete them have been 9 days. So it is a very fast way to get a decision on your claim. Right now, North Carolina has only received about 4 of those claims, but we expect that number to increase as the program expands and as the year goes on. Lastly, for me, I want to talk about the Veterans Appeals Improvement and Modernization Act. This was legislation that was passed last year to expedite the VA appeals process. The Appeals Act establishes a new review process for VA that promises to be timely, transparent, and fair, and obviously provide improved delivery of benefits and services to our veterans. As part of that, the Rapid Appeals Modernization Project was launched in November of 2017 as the first phase of implementation of the law. Participation in RAMP is voluntary, but veterans can expect to receive a review of VA's initial decision on their claim in a much faster time frame than they would in the legacy appeals program that we have currently. RAMP is going to run through February 2019, which is the target date for full implementation of the Improvement and Modernization Act itself. And just some of the benefits of RAMP. As I mentioned, it's voluntary. Once veterans choose to enter RAMP, they cannot go back to the legacy process for their appeals. But RAMP does provide expanded opportunities for veterans to have more efficient claims review of their process. More efficient claims process review. Participants have their decisions reviewed in either a higher level or a supplemental claims review lane, and that's outlined very clearly in the law. Under the higher level review, the reviewer can either overturn previous decisions based on a difference of opinion, or they can return it to VA for correction if an error is found. The supplemental claim lane, participants may submit new evidence and may also receive assistance from VA to develop evidence in support of their claim. Veterans who disagree with their decisions in RAMP will have the opportunity still to appeal to the Board of Veterans' Appeals, and those appeals will be processed and decided by the board when the new law is actually fully implemented starting in February of 2019. So that's all from me, and I'm going to turn it over to Megan to talk specifically about disability compensation benefits.
Megan, if I could real quick before you leave, I just want to point out that right now that RAMP program is still by invitation only. The VA has to send you a letter asking you if you want to participate. If you have an appeal pending, you can't just automatically say you want to go into this program. It's by invitation only, so I just want to make sure that that's clear to everybody.
Affairs, our Winston-Salem Regional Office, and I'm Assistant Veteran Service Center Manager there. And I'm excited to be able to talk to you a little bit about the benefits that we provide. We find that, as Leanne mentioned, so many veterans don't realize that these benefits are available to them, then they are not taking advantage of them, or sometimes they don't even realize that they are veterans. I've had one person tell me, well, I only served 6 years, so I'm not a veteran. We want you to know that you are a veteran and that you are entitled to come and seek assistance from us because you earned these benefits. We're going to give you an overview of disability compensation, pension, benefits for family members, and the way that our work is distributed in the National Work Queue. Sorry. First, disability compensation. What is disability compensation? It's a tax-free benefit paid to veterans for a chronic disability or disease that either arose during service, was worsened or aggravated by service, or is presumed by VA to be related to military service. The first key word here is chronic. It has to be a chronic condition such as diabetes. It can't be something such as pneumonia that was an acute illness that resolved and there are no lingering effects. So it has to be a chronic condition first. Arose during service is pretty self-explanatory. Something happened during service and we can have an event or an injury or an exposure that we can prove. Was worsened or aggravated by service. In general, there's a presumption of soundness when you go into the military, that you are fully healthy when you start, and so whatever disabilities at the end are the result of service. On occasion, though, there can be things noted at the entrance exam that were not disqualifying, but if that non-disqualifying condition became worse because of service, that may also be entitled to service connection. Finally, is presumed to be related. Those can be conditions such as diabetes or some due to Agent Orange exposure, or perhaps certain cancers due to contaminated water at Camp Lejeune. There is a monetary benefit implied with service connection, and that's only if that's at the 10% level or higher. Now, a grant of service connection at the 0% is a grant because you are receiving benefits in the form of medical assistance, and it might also entitle you to other benefits later on. Service-connected disabilities might be physical conditions, such as a chronic knee condition, or it might be a mental health condition, such as post-traumatic stress disorder as a result of military sexual trauma or having survived an IED blast. Veterans must use a VA Form 21526. This is new, that there are not other options for the way in which to file the claim. We want to make sure we tell you that. It has to be on that form. We do recommend submission as soon as possible after service or as soon as the condition develops. A veteran may apply at any time, but the benefit of applying soon after service is that the required nexus, the linkage between the chronic condition and service, is easier to substantiate when there's been less passage of time. Like I mentioned with the 0% service connection, veterans may come back to VA and be reevaluated if they say that the condition has gotten worse. We just need new medical evidence, or we may order an examination and the new benefit may be described. The 0% may turn to 30%, for example. Veterans may establish entitlement to things that were worsened by a service-connected condition. So you may have a disability or condition that has nothing to do directly with service, but it was caused by something that was caused by service. For example, a bad knee causes an altered gait. After many years, now you have hip pain. The hip may be entitled to service connection. Additional entitlements wanted to note. Individual unemployability, you may have heard about this. Veterans who are unable to maintain substantially gainful employment as a result of the service-connected condition, it must be service-connected condition, may be entitled to individual unemployability, which is a higher rate of payment. It can be related to one condition or a combination of conditions. Special monthly compensation may be available. It's also additional level of compensation for various types of anatomical losses or loss of function. such as, but it must be related to the service-connected condition. Aid in attendance is a benefit if you require the assistance of another person for the activities of daily living, for example, such as feeding yourself, dressing yourself. VA offers two broad categories of pension benefit programs. Want to note a couple of differences between pension and compensation that are most relevant. First, the veteran must have served during a period of war as declared by Congress, must have meet an income threshold, but the disabilities that are impacting the veteran do not have to be service-connected. Now, it's possible that they are service-connected and that the pension is a greater monetary benefit to the veteran and they elect pension. Or on occasion, when we're dealing with a hardship case or a homeless case, we might be able to establish pension and then while we're trying to prove service connection so that they get immediate assistance. Additionally, the income can be adjusted based on certain expenses such as mileage for going to medical appointments, prescriptions, paying for skilled nursing care. Survivor's pension is also a tax-free monetary benefit for low-income, unremarried surviving spouses or children. And again, the veteran has to have had wartime service and has to meet the income, you have to meet the income levels. Now, if the death was related to service, there's a different benefit entirely. And again, veterans and survivors who are eligible may be entitled to additional monetary compensation based on their personal health, such as if they need aid and attendance themselves. Here's a few of the benefits available for spouses, children, parents, and survivors. Dependency benefits, an additional compensation amount if the veteran is service-connected at 30% or more. Dependency and indemnity compensation, that's if the death was deemed due to service. Home loan eligibility, life insurance, civil service preference for the family members, benefits for certain children of Vietnam veterans with disabilities, fiduciary services, and memorial benefits, including pre-need eligibility, which is new. It's very interesting for a lot of people. They can get a determination in advance of passing that they will be entitled to the service. Please refer to the resources at the end of our presentation for more details, like form numbers and websites. Finally, just going to go over a couple of notes about our national work queue and how it relates to veterans being served in North Carolina. National Work Queue is an electronic system that allows the claims to be routed across the nation to maximize efficiency of our resources and keep our claims prioritized in the way the Secretary has outlined. It allows us to improve service by being more efficient. Additionally, we can take work from one area to another in the event of a localized emergency, such as a hurricane. While we no longer work exclusively North Carolina veteran claims at the Winston-Salem Regional Office, we do get more North Carolina claims than other people. But a claim might be worked from a North Carolina veteran in Texas or in Maine, and that's just the way that the system works in order to improve service overall. Now, Shai will discuss VR&E and education. Thank you.
Good afternoon. My name is Cheyenne Irwin, and I am the Supervisory Vocational Rehabilitation Counselor out of the Fort Bragg office. I'm here today to talk to you about vocational rehabilitation benefits. It seems today that our focus is on suicide and the impact of mental health when individuals are transitioning from service. As a rehabilitation professional, I like to believe that the promise of work and a new identity is one way to help curb that issue. Vocational rehabilitation provides services to individuals who have a service-connected disability and, as a result, an impact to their ability to work. Individuals are eligible for this program up to 12 years, and we have a maximum of 48 months for this benefit. You'll notice that most of the GI Bill benefits are a 36-month benefit, and vocational rehabilitation is 48. Veterans must have a service-connected rating of 10% or greater in order to apply for this service. This is what we call eligibility. They must have an other than dishonorable discharge, and a vocational rehabilitation counselor must determine that they have an employment handicap. An employment handicap is the impact of the service-connected disability creating a barrier to employment that the individual has not overcome. In addition, we provide services to transitioning service members to help bridge that gap. Automatic entitlement is available to every service member who is working through the med board process. Or we can also provide services if the service center is able to presume a disability. This is called a memorandum rating, indicating that the veteran is more likely than not to have a 20% rating. The types of services that vocational rehabilitation provides are typically education or on-the-job services. So we do provide education at an institution of higher learning. We provide apprenticeships with journeyman programs through a partnership with the Department of Labor. We provide on-the-job training and non-paid work experiences, which are similar to internships, and then the veteran would receive a subsistence or a payment in order to participate in that to help overcome with some financial difficulties. We also provide career testing and counseling so that the individual is not going at it alone. What are some of the benefits of vocational rehabilitation? Some of the benefits, as I mentioned, were the types of programs that we offer. Also, we provide a payment to the veteran while they are participating to help overcome any of the financial barriers that could be associated with attending college instead of performing work activities. We also would pay the post 9/11 rate, which typically is a higher rate. So there's a vocational rehabilitation rate, which is based on the veteran and the number of dependents. And then there's also a post 9/11 rate if the individual is eligible for that particular benefit as well, so that they're not losing a monetary benefit for pursuing vocational rehabilitation. In addition to those benefits, they get a one-on-one case management program with a certified vocational rehabilitation counselor that assists them in looking for suitable employment that will no longer impact their disabilities and allow them to go forward with career growth. The counselor will facilitate successful completion. So that means that they're following them through and assuring that they have the services that they need in order to complete the program, so the program will lead to employment. In addition, we provide educational and vocational counseling for transitioning service members to assist them in determining what benefits are best for them upon discharge from the military. Here in North Carolina, we have 7 locations. Our hub is in Winston-Salem. We're located also on Camp Lejeune and Fort Bragg. In addition, we provide services at ECU on the campus and Asheville, Salisbury Medical Centers. In 2017, the North Carolina Department of Veterans Affairs Voc Rehab program assisted veterans in many ways. Part of this impact is that the salary of an individual working prior to entering the vocational rehabilitation program was $531 a month. When they completed the program, they were making an average of $3,466 a month. We assisted 583 veterans in the state of North Carolina to meet their vocational rehabilitation goals. This is an increase of 42% from the previous year. And 71% of the individuals who found suitable employment had no employment at all when they came to our program. So they went from being completely unemployed to having suitable employment that would no longer impact their disabilities. We also processed 5,325 applications in the fiscal year of 2017, which is the 5th highest in the nation. 61% of those applications were received in an electronic format, such as e-benefits. We held 49 job search workshops where we assisted veterans in understanding how to develop a resume or to properly interview or to complete a federal employment package. The top employment fields here in the state of North Carolina are computing and networking technicians, medical office support, accounting, truck drivers, nurses, physician's assistants, and veteran service representatives. We have several employer partnerships throughout the state of North Carolina. Some of those partnerships are the Fort Bragg Human Resources Division or Division of Military Personnel, the city of Fayetteville, as well as the city of Charlotte, Salisbury and Asheville's Medical Center, the Charlotte Hornets, as well as the Winston-Salem Service Center. So we have veterans serving veterans. In addition, we've continued movement towards a paperless environment, processing 26,000 files and pulling them from our regional office into an electronic system, which coincides with compensation and pensions department. So now those claims are accessible not only through the service center, but also nationwide. Anyone can look at a vocational rehabilitation file electronically. This year we did several partnerships. One of those partnerships was with the North Carolina Division of Vocational Rehabilitation. So there's state level vocational rehabilitation as well. And we partnered with them to emphasize on an independent living service that's also offered through vocational rehabilitation. So if an individual has too much of a functional impact on their disability that prevents them from working, we have a prong of our program for independent living services. And we partner with the state in order to make sure that those services are provided in the most robust fashion possible. We also work with the North Carolina Department of Labor in order to assist us at the beginning of services for a veteran to work towards labor market information and assure that the program that a veteran's training for will have employment when they continue their education program, and also at the rear end to go through their NC Works database of employment opportunities and assist them in finding placement. I also would like to talk to you about what are the differences between the GI Bill and vocational rehabilitation. The GI Bill benefit programs are an education program. They are designed to provide educational support for veterans, whereas vocational rehabilitation is a focus on employment benefits. There are several different GI Bills, and I know a lot of times veterans will get a little bit confused about what program is best for them. So we have the Montgomery GI Bill, Chapter 30. A lot of individuals will refer to this as the old GI Bill. The old GI Bill pays a monthly stipend for educational costs and is paid directly to the beneficiary. The post-9/11 GI Bill will cover full tuition and fees as long as it's up to the yellow ribbon level of the state, and it's paid directly to the school, so the veteran's no longer required to pay their own tuition or manage their own finances in order to assure that tuition is covered. They also offer them a book stipend each semester, as well as a monthly living stipend that's equivalent to an E5's BAH with dependency. The post-9/11 Yellow Ribbon Program is a program that allows for higher cost schools to charge tuition at the rate of a public institution within the state. So it allows for veterans to attend private schools and still stay within their benefit cap. And they can also transfer this entitlement to spouses and dependents. One new piece of legislation is the Forever GI Bill. The Forever GI Bill, or the Harry Colmery Veterans Educational Assistance Act, did a few things to help promote the utilization of the GI Bill. One of those is that there used to be a time limit on how long you had to utilize your GI Bill benefits, and they have now taken that time limit away. I'm sorry. For individuals who are eligible for that benefit and left service from after January 1st, 2013. And in the process, individuals who had utilized this benefit but were affected by schools closing down or programs that were no longer approved for the GI Bill, that type of benefit will now be restored to the veteran as well, so they can go back and utilize their benefit at a school that will have an impact on their future. It also would do similar thing for an individual who utilized the REAP benefit. So for our reservists who use their education benefits, they now may have a restored entitlement to their education. It also permanently authorizes specific work studies and expands our vet success on campus. Some of the benefits available to dependents are the Marine Gunnery Sergeant John's Fry Scholarship, also commonly known as the Fry Scholarship. And it's available to children and spouses who had someone who died on active duty following 9/11. In addition, there's Survivors and Dependents Educational Assistance, which is an educational program that's granted underneath the compensation program, so it is a rating. And the eligibility is a dependent of a veteran who is permanently disabled due to a service-related condition or who died while on active duty service. There are additional services available for eligible spouses or children who have a disability so that they can acquire counseling and case management during that program. And that's all I have for you today.